Hello everyone, welcome back to Cmme and I hope you all are doing very well. Today we are about to begin a new series Epidemiology. There will be multiple classes on epidemiology and the videos will be uploaded separately on this channel. But before I begin, dear students, I must remind you that the content of our channel are meant to supplement your knowledge, not to substitute or replace the regular online and offline classes in your institution. So, please do attend your classes, do not skip them. Now, today we are going to introduce epidemiology to you. So, that is why we are going to discuss the definition of epidemiology, different components of epidemiology, the aims and the uses of epidemiology. Epidemiology is probably one of the most commonly asked definition during your practical examination. Also, it can be a part of long question in the theory exam. Also, uses of epidemiology is another very commonly asked long question. Now, if we break down the word epidemiology, it comprises three different Greek words. Epi means upon, demos means people or population, and logos means the study of. So, epidemiology actually means the study of what is upon the people. Now, till 24th edition of Park, the definition of epidemiology which was given in the book is like this. It was given by John M. Last and it says, epidemiology is the study of distribution and determinants of health related states or events in a specified populations and the application of this study to control the health problems. Now, from 25th edition, a new definition has been added to the book. This definition was taken from the Dictionary of Epidemiology by Michael Porta, International Epidemiological Association, published from Oxford University Press. So, let us look at the definition. So, epidemiology is basically the study of the occurrence and distribution of health related events, states and processes in specified populations, including the study of the determinants influencing the process and the application of this knowledge to control relevant health problems. Now, this is a little bit longer definition as compared to the previous definition. I believe once we understand the definition, the meaning of the definition, it becomes easier for us to remember it. So, that is why in the next slide, I have written the definition once again, but I also have color coded few words and I am going to describe these words so that it becomes easier for you to understand this particular definition. So, first thing is epidemiology is basically a study. So, when we say study, we actually means making observation or conducting surveillance. We can also do screening procedures. There is scope for hypothesis testing, analytical research, etc. We can also conduct different experiments and make predictions based on our observation. Next is the occurrence and distribution. So, occurrence means something that is happening, right? So, it can be expressed as incidence, prevalence, etc., which we shall discuss in future. Coming to the distribution, when we say distribution of a disease or health related states, events, etc., we actually mean person distribution, place distribution and time distribution. Person distribution means who are the people who are suffering more. That means whether any particular gender is suffering more from a particular disease, whether a particular age group is suffering more, like this, any particular occupation. So, maybe this occupation has some role in occurrence of the disease, like that. So, these are person distribution. What about place distribution? If there are more number of cases in any particular geographic area, so we can say that this disease is more common in that particular geographic area for some reason. Then we can obviously make some further investigation so as to find out the reasons behind it. So, that is place distribution. Okay. What about time distribution? Whether any disease is occurring more in any particular time of the year. So, this is place, person and time distribution. Next is health related events, states and processes. So, in simple words we can say COVID-19 is a disease, right? Malaria is a disease, hypertension is a disease. Is pregnancy a disease? No, of course not. We cannot label pregnancy as a disease, rather it is a health related state. So, of course it is related to our health, but it is not a disease. So, that is why these bigger terms, that is events, states and process, they actually mean the diseases, different disorders, disease outbreaks and epidemics, different causes of death, different behaviors which can lead to development of a disease. For example, maybe in a chronic alcoholic, chronic pancreatitis is obviously expected. Hepatic encephalopathy can occur like this. If a person is addicted with smoking, long term smoking, he can develop lung cancer, COPD, etc. So, these are the behaviors. Also, there are some socio-economic and environmental processes, effects of different preventive programs, use of health and social services, etc., which can be considered under events and states and processes which are health related. So, necessarily they are not diseases only, they can be related to disease directly or indirectly. And of course, we always specify a population. When we say the number of dengue cases in the month of say July 2020 is this, we must mention in which population we are talking about, whether we are talking about any particular district or a particular state or maybe a country as a whole. So, that is why it is very important to specify the population, right. Next is the determinants. Determinants basically means the underlying causes, the risk factors, etc., which can cause the disease or can actually influence the occurrence of the disease directly or indirectly. And of course, the last one is the control, because with all the informations we can get, our ultimate aim is to control the health related problems so as to improve the health status of the community. So, I believe if you understand this particular terminologies in this definition, it will be easier for you to understand the definition as a whole. Next one is the components of epidemiology, and we are going to talk about three components. First one is the disease frequency. Now, disease cannot be measured directly, right? So, that is why we try to quantify disease indirectly. So, when we say disease frequency, what we try to do is to measure the frequency of the disease, disabilities, death, and then to summarize them in forms of different rates and ratios. So, in future we shall talk about different rates and ratios. Also, we try to measure the health related events and states in community in terms of health needs, demands, activities, tasks, healthcare utilization, etc. For example, suppose in a block we try to find out the number of hospitals that is present. Then I also try to find out the number of persons suffering from a particular disease. So, then we can compare whether this number of hospitals or healthcare service centers are adequate to serve all the people suffering from that particular disease. So, from that we can have an idea about the health need of that particular community for that disease, etc. Also, if the health services are available in a community, whether people are availing the health services or not. So, all this comes under the disease frequency, but let me remind you again, disease frequency does not always discuss on or rather talk about the disease itself, but also disease related activities, needs, demands, etc. Next is the distribution of disease. As I already mentioned, it can be place distribution, it can be person distribution, or it can be time distribution. Place distribution as in if any particular geographical area there are a lot of cases, more cases as compared to other areas. Person distribution means whether any particular gender, particular age group particular occupation, particular socioeconomic status that is being more affected as compared to the other segment of the community, and time distribution as in which time period of the year these diseases are occurring more. So, for example, respiratory infections occur more during the winter seasons when the humidity is less, the air is dry, etc. The mosquito-borne diseases are very common during the monsoon and after the monsoon season, and also diarrheal diseases are very common during the monsoon season because of the contamination of water, etc. Next is the determinants of the disease. So, all the etiological agents which can be bacteria, virus, fungus, anything that can cause the communicable diseases are also the risk factors. For example, smoking, obesity, dietary pattern, etc. that can lead to non-communicable diseases are discussed under the determinants of disease. So, that is why the disease frequency, distribution disease and determinants of disease are considered the components of epidemiology. Next, we are going to talk about the aims of epidemiology. So, according to the International Epidemiological Association, there are three main aims for epidemiology. The first one is to describe the distribution and magnitude of health related disease problems in human population. So, of course, first thing that we need to do is to quantify the health problems and the magnitude of the health problem. So, that means how serious the situation is, that is the first thing that we need to know. The second aim is to identify etiological factors or risk factors. So, what are the reasons that is giving rise to the number of cases we have, whether there is any infection or any particular type of behavior that is leading to the disease. For example, if a person is chronic smoker, he can develop COPD. If he is a chronic alcoholic, he can have pancreatic diseases, he can have hepatic encephalopathy, etc. If there is stagnation of water around our houses, there is chance of mosquito breeding leading to mosquito-borne diseases like malaria, dengue, etc. The next aim is to provide the data essential for the planning, implementation and evaluation services of the prevention, control and treatment of diseases, and to setting up the priorities among the services. So, with all the data available to us, that means the magnitude of the health problem, the determinants of the health problem, etc., we can plan accordingly and then implement different preventive and control measure to control the situation, right. Also, we have to evaluate the services. So, whether whatever preventive and control measures are going on, we can evaluate them against some kind of standards. So, there is always scope for improvement. Maybe some things that we are doing wrong, we can rectify them. Maybe there are some things that we need to modify accordingly. So, evaluation is very important. Also, setting up priorities mean, given the infrastructure we have, the manpower we have and also the financial support we have, that means the resources we have to set our priorities. So, whatever is feasible with given infrastructure, manpower and money or financial support, we must go along the programs which will support it by that. So, we can say the ultimate aim of epidemiology is to eliminate or reduce the health problem or its consequences. So, of course, what we want is to reduce the disease burden and other health related burden in the community and to promote health and well-being of the society as a whole. So, these are all the aims of epidemiology that we have already discussed. Coming to the next part, that is the uses of epidemiology. So, I have divided the use of epidemiology under certain headings like understanding disease processes, use in public health practice, use in clinical practice and uses in healthcare management. So, we shall start with uses of epidemiology in understanding the disease process. The first one is studying natural history of disease. So, what is natural history of disease? So, after inception of an infection or risk factor or adapting some risky behavior, then progression of the disease procedure in a human body up to the consequences, that means the outcome, possible outcome. So, all these things are considered as the natural history of diseases. So, it is very important for us to understand how a disease occurs in a body, human body, how it progresses and how it ends, and this is important in terms of prevention and control of the situation. Next one is searching for causes and risk factors. So, of course, with epidemiological studies, especially with different analytical study, we can try to find out different etiological agents, risk factors, etc., leading to different communicable as well as non-communicable diseases. Historic studies of rise and fall of diseases. So, if we observe a particular disease over many years, maybe many decades, we can see that maybe the number of cases have been decreasing over the decades and ultimately the disease is eliminated. Let me give you an example. Smallpox, it initially rose to its peak, then it killed millions of people and then was finally eradicated, right. So, right now there is not a single case of smallpox for about last 3 decades. So, this is historic studies of rise and fall of diseases. And then identification of syndromes. What is syndrome? When 2 or more different medical phenomena, which can be signs or symptoms, they occur more frequently together than they can be accounted for by chance only. So, I will give you an example for your understanding. There is something called syndrome X or metabolic syndrome, where you will find people with obesity, especially central obesity. They also have hypertension and dyslipidemia in terms of high LDL level, low HDL level. Also, impaired glucose tolerance can be there, or even diabetes can be there. So, these are the signs or symptoms, they are together sometimes, and you will also find these are the people who are at high risk of development of ischemic heart disease or congestive heart disease, etc. So, that means it is not possible to have all these signs symptoms together only by chance. That means there must be some kind of common risk factors leading to all these signs and symptoms, and they also act as a prognostic factor to development of different heart diseases. So, that is why syndrome identification is also useful by epidemiological evidences. Now, coming to uses in public health practices. First one is investigation of epidemics. So, if you suddenly find out that a large number of cases of a particular disease are appearing in a geographical area, then we have to find out whether this is an epidemic or outbreak of a disease. Now, these two terminologies are different, but today we are not going to discuss epidemics and outbreak, we will discuss them in future. So, anyway, let us assume that there is an epidemic of a disease. So, we have to find out the reasons behind the epidemic and also to try to control the situation, and epidemiology will help us with that. Next is surveillance for disease. As I previously mentioned, when we follow a disease for a long time of period, we have an idea about the number of cases, that is whether it is rising or decreasing over time. So, trend can be identified, and with that trend we can also make projection in future. So, from data for last 2 decades or 3 decades, we can have some idea what will be the number of cases approximately, say about 10 years from now or 20 years from now, right. Next is disease screening programs. By screening we mean to try to find out diseases in people who are apparently healthy. So, as you know, say a person with pain abdomen has gone to a doctor. After USG, he was found to have gallstone, cholelithiasis, and he was suggested for an operation. Now the anesthetist who will fit the particular patient for operation, he found out that his blood pressure is elevated, or maybe his sugar was elevated, he has diabetes. So that means even though the person did not have any symptoms of hypertension or diabetes, he was accidentally diagnosed to have those problems. So this is known as screening program. The screening program means finding out diseases in people who do not have any apparent signs and symptoms. They look apparently healthy for that disease. Next is formulating medical teaching curricula. Of course, during preparation of undergraduate curriculum or postgraduate curriculum by MCI or NMC, whatever, they always focus on the more relevant health problems in the given country, right? So in India, we shall talk about the health problems which are more common in our country rather than which are more common in Western or developed countries, and the curriculum will be made according to that. The next one that we are going to talk about is the uses of epidemiology in clinical practices. So assessing the effectiveness of treatment modalities or assessing the effectiveness of preventive modalities. Just let me give you an example. Suppose there is already a drug existing for a particular disease. Now I come and claim that I have made or rather developed a new molecule which will work better than the existing molecule. So for that I need to do some kind of drug trial so as to prove whether my drug or my molecule is better than the existing molecule. So these treatment modalities can be compared. Same thing for the preventive modalities. For example, we know right now we are having the COVID vaccines. There are a lot of discussion, controversies regarding which one is better, whether Covishield is better, whether Covaxin is better, the new vaccines which are being developed, whether they are better or not. So this effectiveness of different preventive modalities can also be compared. Another example, which is a very simple one, during family planning, that means when couples are avoiding unwanted pregnancies, we can compare the effectiveness between different family planning method. So whether usage of condom is better or usage of copper T is better or oral contraceptive pills are better, these things can be compared in between. Studying prognostic factors. What is prognostic factor? That means presence or absence of some factors in a patient or in a case can actually influence the outcome of the disease, right? So after careful observation for many years, we have identified a lot of prognostic factors for different diseases, and from that we can say, since this person are having these prognostic factors, there is high chance that this person will die within 5 years, say just an example, or maybe will get better very soon. So like this, so prognostic factors can also be identified by different epidemiological approaches. Studying effectiveness of diagnostic modalities. Again, same thing. To diagnose a particular disease, we can go for multiple options. Different tests can be done. So whether we are going to do RT-PCR or rapid antigen test for COVID-19. Right now we know that the sensitivity of RT-PCR is more, right? So that is why we prefer RT-PCR over rapid antigen test. So these diagnostic modalities can also be compared. Also assisting in clinical decision making. Again, I am saying this thing that since we have been making observations over many decades, we already have developed a lot of ideas, we have the knowledge, and we also have the experience to make different clinical decision based on previous findings. Now coming to the last one, that is the uses of epidemiology in healthcare management. First one is making community diagnosis. That means in epidemiology we not only deal one-to-one with a patient but also deal with the problem in the community as a whole. So that is why what are the different factors which lead to different diseases or health problems in a community, we try to find them, and based on that we try to find out the health problems in the community, which is called the community diagnosis. based on community diagnosis, we can plan certain preventive or also control measures in terms of different health services. For example, we already have so many health programs at state level, district level, even at national level for say malaria, tuberculosis, rabies, HIV/AIDS, non-communicable diseases, etc. Also, there are scope for evaluation of the health services. So, since with the change of time, the situation can also vary, the priorities can also vary. So, that is why we may need to modify or change the existing structure and functionaries of different health services or health programs. So, there is always scope for evaluation of the health programs and services. And last one is the developing of health policies. Just for an example, when COVID vaccines were introduced, it was decided that the frontline workers or the health workers and other related people to healthcare services, they will be given the doses first. Then the next susceptible people, that is the old age people or elderly people who are more than 60 years, they were the next candidate for receiving COVID vaccines. So, these are the health policies which are made based on observations and lot of inferences that were drawn after epidemiological evidences were gathered. So, these are more or less different uses of epidemiology. Again, I mentioned that this is a very commonly asked question, especially in theory question. With this, I will conclude today's session, but again I will request all of you to please subscribe to our channel. Do like the video if you like it. Also write your view in the comment section. Share the video with your friend, with your batchmates who may be benefited. Also, there is our Facebook channel which I will give the link to. Please follow the channel. Thank you very much, and we shall see you in our next video.